Thank you, Mr. Chairman. And to my colleague from North Carolina, Mr. Butterfield, I'm going to kind of extend some of the questions to you, Mr. Cohen, where Mr. Butterfield left off.
And adjoining districts, we might add.
Yes.
Adjoining districts.
You know, my colleague, pointed out that about 107,000 have enrolled in North Carolina. That's the figures that we're seeing. However, 473,000 received cancellation notices for their health care policies that they already had. So even though that 107,000 may sound impressive, we are way behind on those who have had their policies canceled. So there's a lot of making up to do. I do want to get back to some of those numbers. Now, correct me if I'm wrong, how many people in America do you believe have signed up for coverage now?
Well, the most recent figures that we put out were 2.2 million, and that's just in the marketplace. Obviously, there are people who are buying coverage.
So the 6 million figure that I keep hearing today, where is the 6 million figure coming from?
That's taking the 2.2 and adding 3.9 million who enrolled in Medicaid.
Okay, so so basically what we're doing is we're culminating. And are you aware that the Washington Post gave 3 Pinocchios to this number? Are you going to keep this figure?
I didn't see the Pinocchios. I'd have to take a look at what they called into question.
So you agree with the $6 million figure? You believe that there have been 6 million?
I believe that as we reported, 2.2 million have enrolled in marketplace plans, and about 3.9 million had enrolled in Medicaid. And I think the Medicaid number was actually only through November.
Okay, now of those who signed up for Medicaid, how many of them could have previously signed up for Medicaid but did not before Obamacare was instituted?
I don't have that number for you.
You don't have the number? Can you get the number?
I can certainly ask my colleagues in Medicaid if they have that number.
Okay,
I don't run Medicaid, so
that doesn't fall under you.
No.
Okay. Well, so now we have a situation where we have a number of Medicaid that signed up. Wonderful. We want to make sure that people have coverage, that is applicable to them. But isn't this going to play into the cost factor, especially for those states? When we don't really know where the numbers fall out as far as those who could have signed up before but did not for whatever reason and now have.
Well, the states that expand, the newly eligible will be paid 100% by the
newly eligible, but those who could have received coverage before, the states are going to be responsible for a percentage of that, correct?
That's right, under the usual match, yes.
Okay. Now, you said you don't have the number, you don't have the figure. When we had Secretary Kathleen Sebelius, she said that she did not have that number, and I believe she actually said that they could not get that number. So I would appreciate if you could get that to us in the committee, because that I think the thing of it is, and I'll just quote the Washington Post fact checker. Basically what he said is this number tells you almost nothing about how the healthcare law is affecting Medicaid enrollment. Reporters need to stop using it, because basically, and that's a quote, because it's very misleading. It's very misleading. Now, I do want to get back. I've got a little bit more time here. We're all sharing stories about our constituents, and, some of the stories that we've heard have been positive. I want to hit on the issue of the change for women, because I keep hearing about the issue about, bringing down costs for women. However, I have a woman who was formerly in my district, is not in my district now, from Rocky Mount, North Carolina, who basically reached out to my office and through, personal situation, lost her health care coverage. And now the plan, she was paying $254 a month. Now she's going to have to pay $610 a month. She simply cannot afford it. She's probably going to have to choose to not take coverage. How, when we continue to claim that health care has improved for women with, mammograms, when we call these things free, how did we go from $254 a month to $610 a month, and we can still claim that she's getting free services?
So again, I really can't address an individual situation without knowing more of the specifics. Would be happy to have folks talk to her if she is interested.
Well, I would appreciate that. I will have my staff get that information to you and your office so that we can work. Because if we are really going to take care of women in this country, healthcare issues for women, let's be straight on it. Let's make sure that we are getting the points across, because women's health is very, very important.